Immediate implant procedure where this tooth, which is loose and is fractured and has abscess or pus coming out through the gum, and you can see how this tooth is broken. It's infected and needs to come out. As visible on the x-ray, this tooth, the crown of the tooth has fractured off from the root of the tooth. So this tooth cannot be saved. The tooth has to be removed. But the way this job is being done is that we're going to remove the tooth and place the implant same time. So there will be no cuts or no stitches in this procedure. So the tooth will be removed, and then after that the socket will be cleaned thoroughly. The socket will be scrubbed with antibiotic soaked gauze, and then after thorough cleanup we'll make space for the implant, and an implant will be placed. So the idea is that we remove the tooth without causing any collateral damage. We don't want to cut any gum. We don't want to raise any gum. We want to preserve the socket as much as possible. So once the tooth is removed, then we can start our cleanup process. And after cleanup process, then we can prepare the area to place an implant. We are trying to pull the tooth out in a very atraumatic way. Slowly loosen it out. So there is nothing to grab hold on to pull the tooth out, and at the same time keeping your finger here so that this wall of the socket doesn't get ripped or broken or torn. So as you can see, the tooth is loosening out. Sometimes it could take a long time to pull the tooth out because we want to be patient and gently make the tooth loose and take it out without destroying the bone of the socket. We are going to suction the tooth. The tooth is coming out in pieces. Yes. The remaining tooth has come out, and now we're gonna start the cleanup. Scrub the socket walls with antibiotic soaked gauze. I keep my finger here to support so the tissue doesn't get torn when I'm cleaning, because the bone in this area has dissolved away from the infection. And then after this, I scrub the socket with antibiotic soap gauze, and we scrub the walls of the socket, and we leave the antibiotic dressing in there for 5 to 10 minutes, and then change the dressing multiple times to disinfect the area before we start the implant procedure. I have put antibiotic there, and as you can see, there are no cuts made. Okay, so we'll leave this antibiotic there and we wait, and patient can be given rest now. Now the implant, after removing the tooth, the implant has been placed in the jawbone right through the socket from where the tooth came out. This is the temporary crown being produced in the mouth right now. I'm gonna remove it. So I'm unscrewing the temporary crown, which is partially made. It's a partially made temporary crown right now. So this is the implant that has been placed inside the socket, and it's a special implant with a narrow neck, so it will allow more space for the bone graft to go around the implant.